Subcutaneous drugs for cancer, a faster alternative to IV infusions. Many of today's cancer drugs have very complex structures that allow them to perform highly specific tasks. Targeted therapies, for example, are designed to precisely attack cancer cells based on the unique characteristics of these cells, ideally while limiting harm to healthy cells. And immunotherapies help your body's own immune system to recognize and destroy cancer cells. Many of these complex drugs are large molecules. They cannot be taken by mouth because large molecules are very fragile. They aren't able to survive the digestive system, which would break them down before they reach their target. To get these drugs directly into your bloodstream, large molecules have traditionally been delivered through an IV infusion. But thanks to recent advances, some of these drugs are now available as subcutaneous injections. Subcutaneous injections use a short needle to deliver medicine just under the skin into the fatty layer of tissue. Many subcutaneous injections can be self-administered at home in just a few seconds. Subcutaneous injections of cancer drugs, however, are typically administered in the clinic and are given slowly over the course of a few minutes. There are real benefits to receiving these cancer drugs subcutaneously. The main one is convenience. They usually require less time in the clinic than IV infusions. You may also be able to receive treatment closer to home. And since it does not require an IV infusion, you won't need a port, except of course if you need it for another medication. Unless there are differences noted, subcutaneous cancer drugs work as well as their IV counterparts. The active ingredient is the same. A special enzyme is added to help the body quickly absorb and distribute the drug. This allows larger volumes of a drug to be injected and in less time. You no doubt want to know how you should prepare and what you can expect. Subcutaneous injections are given on a similar schedule to their IV version. The day before your injection, drink plenty of fluids and follow any other directions you've been given. The morning of your injection, unless your doctor has told you otherwise, eat a healthy breakfast and again follow all directions. Wear comfortable loose-fitting clothes so your thigh or abdomen is easy to access. The exact injection site will vary slightly each time you receive an injection. This helps prevent irritation and protects the tissue from damage so the medicine can be properly absorbed. While the injection itself takes just minutes, your total time in the clinic will differ. Before the injection, you may have blood drawn, and afterwards, you may be monitored for any side effects before being released to go home. As you might expect, there are some potential side effects you'll want to watch for. Just like with other subcutaneous injections, you may get a reaction at the injection site that causes redness, swelling, and/or tenderness. These may be more noticeable than with other subcutaneous shots you've received, due to the larger volume of drug that gets injected and how your body interacts with the cancer drug. Otherwise, the potential side effects are similar to the IV form of each drug. Some of these may be serious. Discuss with your doctor exactly what side effects you might experience based on the drug prescribed for you. And be sure to contact your healthcare team right away if you experience any new or worsening side effects or symptoms. Subcutaneous cancer drugs may not be right for all patients or all tumor types. If you're already on or about to start an IV infusion, ask your doctor if a subcutaneous version is available and is right for you. A message from Cancer Care. Learn more at www.cancercare.org. Cancer Care provides free resource navigation, individual counseling, and support groups over the phone, virtually, and in person, with oncology social workers and resource navigators who specialize in helping people affected by cancer. To talk with one of our social workers, call 1-800-813-HOPE. That's 1-800-813-4673. Our social workers can help you navigate the emotional, practical, and financial challenges of cancer. The content presented in this video is provided for your information only. It is not intended as a substitute for medical advice. We encourage you to take information and questions to your healthcare provider.